This test is called the load and shift test, and this is to assess laxity in the glenohumeral joint. It can assess laxity, anterior or posterior laxity, or a combination of the two if someone has multi-directional instability. With this test, the patient typically is seated. It can also be done supine, which I'll show next. The patient can be seated, arms supported on the pillow. She's relaxed, and arms at the side slightly abducted, about 10 to 15 degrees. Examiner will stabilize the scapula anterior and posteriorly as the humeral head is grasped anterior and posterior. An axial load will compress the humeral head into the glenoid labrum. And once it's loaded, that's the loading, you shift anterior or shift posterior. And you're checking for laxity and potentially clicking. If there's clicking, there could be possibly a presence of a Bankart lesion if there's an anterior labral tear, and posterior labral tear with a reverse or reverse Bankart lesion may be present. So we're checking for movement. Typically movement, most authors say there should be some movement, approximately 25% of the humeral head movement anterior and posterior. If it's 25 to 50% of the humeral head moving anterior posterior, it's considered grade 1 laxity. Greater than 50% is considered grade 2 laxity, and if it's unstable and can sublux with pressure, it's considered grade 3, the most laxity with that. That's the load and shift test to check for anterior and posterior laxity.